Cast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome. I'm Michael Flora with MTM Services. It's a pleasure to be with you today as we look at our first in a two-part series of coaching staff for optimal performance. We'll have today's webinar, and then we'll also have the webinar for tomorrow, which will focus on kind of our part two of our discussion as we go forward. So let's go ahead and begin our work today. Many of you, I'm sure, are already familiar with MTM Services and the work that we do, but MTM Services is a team of consultants that was built from the ground up with the direct purpose of working with organizations delivering mental health, intellectual and developmental disabilities, substance use, residential, community-based, hospital, and integrated care with primary care physicians and urgent care services. MTM Services has worked with over thousands of organizations in 47 states, Washington, D.C., and 2 foreign countries to implement changes since our inception in 1995. So let's take a look at our content for our webinar for both today and tomorrow. This is an interactive 2-hour webinar. We'll have part 1 today and part 2 tomorrow. Today we'll be looking at really examining the core competencies needed in managing and coaching and developing our teams to address the healthcare shortage, and they need to coach staff to optimal performance as a core competency of senior and middle management in the new healthcare environment. Today we'll be focusing on kind of the state of the current workforce. What are we seeing nationally in our work with teams all across the country? We're going to learn proven strategies to coach, engage, incentivize, and retain great team members. Learn the core competencies needed in middle and senior management to coach staff up in their current roles in order to meet marketplace needs, client needs, and again, even in that integrated care, CCBHC, value-based environment. Tomorrow, we're going to look at our true cost of turnover, especially at the manager and supervisor level, including organizational reputation, outcomes, and the bottom line. We're going to review current performance and evaluations that keep team members engaged and focused, and learn real-life examples on how to implement innovative employee incentives and merit-based compensation in today's environment, and developing kind of your coaching strategy. We'll talk a little bit about that today at the end of our webinar. But how do we start developing our coaching strategy, our implementation plan, to become that employer of choice and increase employee pride in the workplace? There are specific core competencies that we're looking for in the new healthcare environment. These include governance, leadership, access, intake, consumer scheduling, information and medical records management, workforce engagement and human resource management, billing and financial and cost containment, strategic business planning and financial viability, safety and risk management, continued quality improvement and corporate compliance, outreach and awareness. All of this scheduled around outcomes. And our ability to really focus on delivering those outcomes. But primarily, we're going to be focusing today on that workforce engagement and human resource management. We're going to be focusing on some of the core competencies around safety and risk management and what employees are looking for in the new healthcare environment. And then that continued quality improvement and compliance, continued CQI in our organizations around retention, recruitment, and are we including kind of HR in these dialogues around turnover by manager, looking at continuous quality improvement of turnover, retention, and capacity within our organizations. When we've looked at our top behavioral health care workforce concerns and kind of polling our teams across the country, employee retention is definitely one of those that we're looking for. Attracting good employees, really finding qualified candidates in the new healthcare environment. Health and safety concerns, not just during a pandemic, but even, beyond that at this point. Inflation concerns, diversity, ethnicity, and inclusion concerns, labor shortages, managing hybrid versus telehealth workforce. I think anything that we've seen over the pandemic, it's definitely exacerbated the technical and workforce challenges that we've seen over the last 2 years. But now that this is here to stay, really looking at telehealth and hybrid workforce, and we'll talk more about that this afternoon. Legal and compliance concerns, competency and skills assessments. How do I know that staff are truly competent in what they do? I went to a training, I did the online, I did the quiz you asked me to do. I checked the box that I attended the training, but does that truly make me competent? And competition from education and allied healthcare, private practice, and human resource and human service fields. Really looking at where is our competition coming from with actually kind of the largest competition when we talk about strategic business planning. The biggest competition we have is from, we're seeing Walmart, CVS, Walgreens all expand their telehealth practice. Dollar General has now hired their first medical director to begin providing healthcare services at Dollar General stores, but also the apps. In fact, as a licensed professional counselor, clinical counselor, I've received numerous solicitations to join the apps practices across the country with sign-on bonuses. And these are the same solicitations that your staff are getting. SAMHSA has told us that we're going to experience, and we need about 4.5 million additional behavioral health professionals in the coming years. The current behavioral health professional workforce is about 700,000. The estimated need for the workforce is 5.17 million, kind of a shortage of around 87%. The shortages are more pronounced among behavioral health with a 1-to-1 to $1.4 million shortages, with about a 98% shortage in peer support, and even addiction psychiatry of 97% shortage. So when you really start thinking about what is the health professional shortages, the medically underserved areas within your community, and much of the work that I do with CCBHCs across the country, we develop those staffing plans based on organizational need in those markets. So CCBHC is a great opportunity for you to address the needs in the healthcare professional shortage area. But in talking with many of teams that I work with across the country, they're just finding it difficult to find qualified candidates. In fact, one CEO recently told me that they're now hiring individuals that they would have normally passed over years ago as not being qualified or not having the skill sets needed, maybe a little too green in the field. So many providers report they just can't find them. Candidates are difficult. According to the Society for Human Resource Management, it is getting more complicated by the fact that many human resource officers are reporting that 31% reported limited flexibility in hours, that they just can't recruit staff because of lack of flexibility. 41% of HR directors said that finding qualified candidate is a top concern. And when you think about it, blending it, if it's 76%, if it's in person, and 61% if remote. We're also finding, according to SHRM, that ineffective DE&I initiatives were 32% more likely to have climbing recent resignation rates than organizations with highly effective diversity, inclusion, and ethnicity policies, procedures, protocols. So it's more than just I'm good at stuff. Finding that valued candidate to really help you and your consumers in your community. But what we've also seen over the last several years is that the course of the delivery of services, we're seeing managed care companies pay out more than 2 to 10 times more per month since 2020 compared to 2019. And that's continued to rise. From November of 2020 to February of 2021, 33% of all mental health appointments were conducted virtually. And McKinsey even found that 74% of telehealth users during the pandemic reported high satisfaction with the care they received. So what is your current workforce? What is your current consumer population base, current client needs, care pathways tell you about your workforce needs? In fact, in the workforce study provided by the Society for Human Resource Management, you can see the challenges that are faced, with 84% of organizations reported labor shortages and challenges over the past year. Working with teams, some teams are reporting anywhere between 15 to 49% vacancy rates in many positions. So really thinking of challenges within those organizations. And remote organizations actually reported better responses than in-person or hybrid organizations. So you think about legal and compliance concerns, remote organizations reported about 67% of concern, where in-person reported 80%. Labor shortages, 75% for remote workforce, 87% for in-person, which requires us to rethink our current complement of staff. Which ones are hybrid? Which ones are in-person? Which ones are fully remote? Because we know there are dramatic changes possible when executive leadership has a clear vision for recruitment, retention, engagement, and that vision is clearly communicated throughout the organization. And systems are put into place to operationalize that vision. The question is, how will your organization transform their service delivery culture and vision to align with the new workforce trends, expectations, and opportunities? So, to help with this need, more organizations are moving to team-based care, which requires a team-based culture where we have clearly communicated expectations. There's still high levels of accountability. What's interesting is that many organizations in my initial conversations with them is we have difficulty, or we're challenged, or we just can't hold staff accountable, because if we hold them accountable, they will leave. Accountability is still important, but with that we have to have alignment, and that's alignment with rewards, sanctions, and building on an environment of trust and wellness and engagement of our staff. Tell me how to be successful in your organization. Tell me how I will be accountable, but how others will be accountable. See, it's not holding me accountable that's the challenge. It's your lack of holding others accountable that makes me want to leave. What I found over the years is that good people will always find a job. And so we start today with staff engagement and wellness as one of the core competencies in coaching staff to optimal performance. Because if I'm engaged as in a team member, I'm engaged and prepared to engage clients and families. Gallup reported that 37% fewer in-office days for employees in 2022. So think about what that looks like right now for you and your team. They say there's about 125 million full-time jobs in America, and about 50% of them can actually be done remotely. There's no use in me going to the office and doing all my clients remotely, or going to meetings with everybody in the building remote. For many team members, they see that as ridiculous. Why do I bother? Why am I spending gas money? I'm commuting 2 hours a day. So we have to rethink that. Of those who can work offsite, 30% want to be fully remote, while 60% want to be remote some of the time. So as behavioral health care providers, we'll need to review current position and reevaluate these positions. Are they in person, hybrid, or fully remote? That level of flexibility is going to be one of your key drivers in recruitment. We know that there are going to be those positions, let's say like community support, case management, that must be face-to-face or part in person. There's going to be other roles that are hybrid. Some days, based on my patient population, I might come into the office with those very high need or those individuals who may not have technology. And there's going to be those positions that are fully remote. But what supports are we putting into place for all of those team members? So we have to start thinking about engaging the workforce, because we're still running about 33% of the current workforce is actually engaged, which means about 67% of the American workforce is not engaged. But what we found was that during the pandemic, remote workers were more engaged, but they also report at the same time being more stressed. So I'm more engaged as a team member, but I have other issues. Maybe my anger, workforce anger issues, my stress issues might still be there or lower. So being able to, as a manager, as a leader, take those key elements into play. 53% of employees report that the role that allows them to have greater work-life balance and better personal well-being is important to them. Are we leading with that in our recruitment efforts? What level of flexibility are you allowing to build that in? What are my needs as a team member? 22% of employees strongly agree that leadership of their organization is a key element and has a clear direction. So do I have a clear direction? Only 22% of team members feel that management has a clear direction in where we're going. 15% of employees strongly agree that leadership of their organization makes them feel enthusiastic about the future. 13% of employees strongly agree that leadership communicates effectively with the rest of the organization. Those are pretty low numbers, especially in the workforce development modules and consultation that I do across the country. Developing those key leadership, those employee engagement surveys, what do they tell us? The number one concern across the country is communication. Was more health and safety issues, but other issues might have gone by the wayside. Those leaders, those organizations that really truly put communication and engagement as a priority over the last 2 years are the ones that are succeeding in the new environment. Because we know that employee engagement, as we coach team members up, if I'm engaged, I'm more coachable, makes a difference to the bottom line. And leaders, managers play a critical role in team members' engagement. Different types of workers need different type of engagement. So where I used to have like an open door policy, perhaps when everyone was in office, do I have a drop-in time in Teams that folks can touch base with me? Do I have professorial hours that team members can reach out to me? Or am I constantly being pinged on Teams or being texts with team members having questions? Being able to structure appropriate times, check in with team members at the beginning of the day and at the end of the day is always a great idea, whether I'm in person, remote, or hybrid. Engagement has a great emphasis on performance of corporate policies and perks than anything else. And employees are not prepared to engage, cannot engage their customers. And what we know is that engaged team members improve customer satisfaction, that patient experience of care, our profitability, productivity, or direct care. Turnover decreases when team members are engaged. Safety incidents decrease when team members are engaged. Shrinkage or theft decreases when staff are engaged. Absenteeism decreases when staff are engaged. Patient safety increases when team members are engaged. And quality of our work, the business, the clinical, the administrative part of our work, the quality of that work increases when our team members are engaged. And one of the core competencies that we need is around leadership. You heard our founder and chief operating officer, David Lloyd, talk about leadership in our kickoff to our summer series. The relationship between the employee and their manager supervisor is key. So are we operating strength-based management, strength-based supervision with our teams? Are we ensuring that we're enhancing and addressing employee well-being? Are we providing a level of encouragement? What are the specific barriers for individuals not meeting goals? See, accountability is still present, it's still required. One of the big myths about the new value-based environment, or CCBHC, is the direct care no longer matters. Direct service, productivity no longer matters because we're paid for outcomes. Not true. Direct service, those encounters are required. Even if only one of those events in a CCBHC triggers a payment, I still need to know the shadow claims that go with that. Because are we providing a care pathway, a level of care benefit design to reach the leveled and desired outcome? So encouraging team members, what are the barriers? Are they systemic or individual barriers to success? Because that helps us build trust, which allows us to provide that level of support for team members to stay engaged in what we do. Deloitte reports that employee engagement is an employee's job satisfaction, loyalty, and an indication of kind of how they're going to spend their time towards their goals and objectives. The priority here is really looking at, the strategies to help keep people engaged. But what's interesting is they found that only 4% of leaders believe they're even effective in engaging their staff. So a key critical leadership training competency is our ability to engage our staff, to find a level of importance. See, in my work with employees through consulting and businesses around the country, many employers find it difficult to manage their teams to peak performance. So helping coaching me up in the organization, especially in today's environment, they say, well, that's nice, but it'll never work here. See, we have such a tight job market. We're already down, 15, 30% in turnover. If I start holding people accountable, they will leave. We're different. We're rural, we're frontier, we're urban, we're suburban. We tried that. It just really didn't work for us. See, that's not the way we do it here. Have you heard yourself say these things as you begin to review? So the first question I asked in our workforce development work with teams and looking at your coaching and recruitment tools is, would you work for you? Would you join your team of caring professionals today if you were being recruited? What benefits do they offer? What do you like about that? See, we have to review a very wide range of powered packed recruitment and retention strategies, from investing in graduate education to retooling our organization's onboarding. What has happened over the last at least 6 to 8 months is organizations are really spending a lot more emphasis right now on their new employee orientation. One team recently, they said they do a 2-hour employee orientation, and then they pack the schedule. and wonder why people don't come back from lunch. Giving me the time to ramp up in the organization. Think about, what are your current successful employee engagement techniques? What skills do you need to prepare your staff to work in the new environment with consumers, third parties, CCBHC? See, coaching staff up to peak performance really focuses on skills, competencies, training, learning, experience, growth. Help coach me up into the organization. Many of you might have read an article that I wrote several years ago about coaching up or coaching out. We're going to talk about that today with, again, the emphasis of coaching up within the organization. Help me be successful, but it's not a failure to coach someone out. That maybe this is not the right fit in my program, in this department, but where can those skills fit within the organization or even outside? Let me help you find something outside. We do have to focus on well-being of our staff. Being able to provide clear and effective communication. How do I know when a decision has been made within your organization? What goals are we working on? Are there streamlined strategies within the organization? Do I know what I do today, how that fits into a specific goal of the organization? How it fits into the mission and the values of what we do? Or are we chasing every next shiny object or playing whack-a-mole all day long with our staff? Because the work that we do really helps strengthen our team. And so part of the workforce development work that we do with teams is to develop those strength-based models and implement strength-based supervision, really focusing on how we support our teams in supervision. What's the purpose of supervision? Are we aligning both administrative and clinical supervision together, or are they a two-headed monster within the organization? How are we using data in supervision and outcomes to develop those coaching plans? And do you have both the responsibility and the authority to make the changes necessary to support your team? Because again, retention, recruitment, coaching should all be involved in our continuous quality improvement environment. Traditionally, we've seen CQI as just a clinical approach. But I think we have to look at it from an organizational lens. And what elements of continuous quality improvement and our quality plan do we include? Staff retention, staff training, staff competencies. Where does the staff development plan fit in to our CQI and performance improvement? And much of the work that I do with teams for CCBHC, and we're developing the staffing plans and the training plans and the competency plans. Is setting the baseline. What does the population say? What evidence-based practices are we providing within the organization? And are staff trained and competent in those evidence-based practices? What about the evidence-based management practices? Revenue cycle management, accounts receivable, pre-service, point of service, post-service, data measurement. So having teams having both the authority and the responsibility, because in today's employee market, we're focusing on work performance remains a key management responsibility. Managers today must be able to engage and support their teams, because I still quote the Fortune magazine that says that failure to effective and manage low performers is the #1 reason why leaders fail and lose their jobs. And 87% of employees say working with a low performer has decreased their productivity, hampered their development, and made them want to change jobs. So coaching teams up. So we should be coaching 80% of the organization up every year. helping staff be successful and coaching them up. And if you think about your current organization, where do folks lie in their performance across these four domains? So low performers, on my way up to acceptable performance, I'm meeting or exceeding performance, or I'm a high performer. Now, this model is based on Jack Welch's work that he did with GE years and years ago, where he told his managers to coach out 20% of the team every year. And what you end up doing is moving the bell curve. But I think you can do the same thing by coaching folks up. So taking a strength-based approach and coaching up 80% of the organization every year to the next level. So really being able to coach up or coach around or through or out the low performers. If it's not a right fit, it's not a right fit, even in today's environment. Coaching up and then rewarding team members that meet or exceed expectations, with the majority of the manager's time truly being spent in this middle 60%. This is the backbone of your organization. Much of the time, we're too focused on the low performers or the high performers. But see, the high performers have a different set of needs. We want to make sure we're not burning those folks out. That top 50%, we want to make sure we're not burning them out, that we're getting out of their way. We're streamlining processes. We're reducing or eliminating all redundant data and data collection. We're working with a team right now that, my colleague Scott Lloyd, president of MTM, they found over 2,800 redundant data elements that their staff were collecting. They were able to eliminate those. Think about what would happen in your organization if you were able to eliminate 2,800 redundant processes. What would that do for a level of engagement? So really focusing on our ability to set performance expectations and defining successful results. So here's some sample clinical and non-clinical key performance indicators that we've worked with. So do I know as a team member what I need to do to be successful? What are you coaching me to? So if I'm a clinical social worker, I'm going to have 99% accuracy on entering information into the electronic health record. Quantitative compliance. My no-show cancellation rate will be below 10%. Engagement. I'm meeting my recovery goals through level of care, benefit design by 90% of the time. So it can be measured. I used to do this with teams that, it's measured by at least a 10-point improvement or a delta score in the DLA 20. That at least 90% of our consumers and individuals served have at least a 10-point improvement in the DLA. They're meeting their recovery goals, quality outcomes. I'm meeting my direct service targets. See, this is important in a CCBHC environment because I have to predict hours, time, cost, anticipated individuals and services. So am I meeting my direct service target? 100% of activities will still be provided on an active treatment plan. Corporate compliance. Collaborative documentation is the expectation, and all notes will be completed same day. Documentation timeliness. Staff self-care. If I get to go home at the end of the day with my work done, I don't have all these progress notes, treatment plans, assessments hanging over my head. It's a staff self-care tool. On the business and admin side, we're really focusing on copays and deductibles that might have gone away over the last 2 years because we've moved staff to remote. But how are we building basically the telehealth platform that we become a remote organization as well as a in-person organization? The same processes that we have for revenue cycle, copay, deductibles, and collection can be done in a remote environment just as easy as it can be done in a face-to-face in-person environment. We do this every day with teams all across the country. 85% of all appointments will be canceled at least 48 hours in advance. It allows the team members to backfill, get folks off those waiting lists that you might be experiencing. Confirmation calls or reminder texts will go out at least 48 hours in advance. Financial information, accuracy. So you can see by defining the role of success, and I'm coaching around those metrics, those data points, that helps. I go home, I did that today. See, the best job any of us can have is at the end of the day, we know that we did a good job and we get a thank you for it. So really being able to successfully coach our teams. To do that, we really have to define what is it that's expected and be specific. So right now my performance is here. I've got to move that up between here and here between this week and next week. Obtain agreement. Do I understand what I need to do? I need to get caught up on all current documentation, but all going forward, I have to maintain my notes being done by the close of business today. What competencies or skills or training do I need? Did we agree today on a completion date? What are the mini goals between here and the next time or next month or the next 90 days? What are the benefits? What are the benefits of having this done? How will that make me feel? How will that help my wellness? Confirm the team members' understanding of the tasks. Assign authority and responsibility and follow up. And follow up. And follow up again. Again, being very clear, very deliberate in our expectations of our team members. Use the sample coaching logs or supervision logs that really highlight the areas of focus for today. This is a sample individual clinical supervision log. So today we're going to focus on the DLA 20. We're going to focus on your progress notes. We're going to review some data on your outcomes, your no-show rates. Anything that I checkbox up above is going to be a topic of discussion. What accomplishments or strengths do we need to talk about today since our last supervision? What's the support plan? How can I help support you? And be very specific. Again, I need to increase, 2 additional hours per day and schedule based on my current no-show rate of 40% no-show rate. I'm going to make sure that I've got at least 34 to 38 client hours in my schedule this week. Even if I'm telehealth, do I have those hours in? Now, what we've truly found with many of the teams that we've worked with during the course of the pandemic, that direct service hours have increased and no-show rates have gone down, decreased for many of the teams that we've worked with. What training and competency plans and expectations are needed between now and the next time? What's the follow-up date? Any clinical supervision, high-risk clients or needs that I might have. What is the team members' feedback? I sign it, you sign it. Build this into your human resource management system. For our non-clinical professionals, the same thing. What are the expectations, the key performance indicators? What's the topic or summary? What's the solution plan? Because it sets those training and competency expectations and used to communicate team goals and needs. See, I'm a firm believer that every team member in the organization needs weekly supervision, whether I'm admin, support, or clinical. And I need at least weekly team meeting, communication, engagement. So having those opportunities, creating those opportunities, and I'm sure many of you are saying, I'd love to be able to do that, but we're so short-staffed. I'm doing this, and we're spinning as many plates as possible. We have to make supervision and engagement and coaching a priority. Otherwise, we're going to continue to churn staff. And you're always going back, it's Groundhog Day. We're going back and retraining and retraining and retraining new staff over and over and over again. We never get to baseline or above competency. which wears on your managers. See, managers have to address inappropriate or underperformance at the earliest possible. We can't let it continue. So again, I'm coaching you up and provide objective measurement. Here's our current day in the life of report, Mr. Flora. Tell me what this says to you and identify those performance levels you'd like to see. What I know you're concerned, Mr. Flora, about your performance expectations. Which one are you more specifically concerned about? And let's work on that one today, not all of them today. Even have staff members that are meeting performance expectations, provide a case study in team supervision. Celebrate every possible victory. So we always want to celebrate in public, praise in public, correct in private, and bring those areas of performance. But one of the things I've always asked myself, see, the problem of motivating teams to peak performance is usually kind of a lack of reinforcement. When there's a lack of reinforcement in the system, your attention wanders. And so does performance. So we have to be deliberate and reinforce all performance expectations in both a hybrid, remote, and in-person environment. So what levels of reinforcement are there in what we're doing? What motivates your team? And are we really focusing on the amount of reinforcement available in the environment? Being, again, deliberate about reinforcement, providing those office hours, reviewing. And so depending on the culture, the fewer distractions in the workplace, and I see redundant data as a distraction. I see the crisis du jour as a distraction. I see lack of strategy, lack of clear expectations, lack of competency training, skills development as a distraction. See, if there's a lot of distractions available, I need a lot of reinforcement. The fewer distractions in the environment, the less system noise, as we call it, in the environment, the less system noise, the less amount of reinforcement is needed to keep people on task. The less distractions, the less system noise, the more well-being, the more satisfied I am. So when you think about retention strategies and coaching team members, we start off with culture, well-being, a culture of well-being and flexibility. How flexible is this role? Think about successful onboarding, and we'll talk a little bit about that tomorrow as well. What kind of job advancement or training are you offering? Many times we lead with our job posting of what we expect. Well, they're interviewing you. This is still an employee's market right now. So I'm weighing you versus the app that just sent me a notice in the mail, or the competition from another state that knows that I'm licensed in that state also, that allows me to work remotely. What's the market in your compensation? Remote, hybrid, in person? What I'm finding is that many teams are starting to develop, and we're even recommending that if this is depending on the type of job, whether it's remote, hybrid, or in person, there's going to be pay differentials there. If the job is purely in person, that might be a little higher than a remote position. But sometimes we say, well, this is what it pays. When our competition is paying more, and it's not just healthcare as the competition, it's anything. Big box stores are paying more than us in many cases. What financial incentives are we able to offer our teams? What type of support and recognition from supervisors and managers are there? Being deliberate about that. Any additional benefits, tuition reimbursement, health insurance, pension plans? How does your benefit package compare to your competition? And even thinking about best in class onboarding. See, the success begins at new employee orientation. It's that acclimation process that allows team members to engage, and we set the stage for success. These are the expectations. This is how we will support you. This is the learning opportunities. This is the ramp up period. Because when we have successful onboarding, we provide greater quality of services. We achieve better outcomes. There's higher job satisfaction and continued job satisfaction. We have increased revenue because we have engaged team members. And we'll talk about when staff members leave, how much that costs you in a fee-for-service environment. How much that costs you in a value-based environment. When we have successful onboarding, we have greater commitment of our team. Improved time to productivity, lower turnover, or the outcomes of that onboarding. So what does that look like for your organization? How long do I have to be successful? Have we clearly laid that out over the course of a night? Remember, one of the things that I recommend with teams when we do this workforce work is that new employee orientation is the first year. What is your percentage of team members that leave after the first year, after the first 6 months, after the lunch, after the first day? See, the goal of this is to actually improve retention, familiarize the team member with their job, workplace culture, other team members, that sense of belonging and feeling welcome. Where do you want to spend your money, your resources, at the beginning, or always catching up? It's really thinking of ways that we can improve employee orientation to set the stage for successful coaching and engagement of our team members. Think about retention strategies. Many organizations are beginning to put in pay increases for staff. Looking at our unrealized capacity, I'm going to take these positions, not fill them. I'm going to reinvest these resources and dollars into new employees or the existing team members. What happens to those team members that stuck with you over the last 2 years as other people are out, left, and they had to pick up the slack? We know that staff are doing at least 30 to 40% more now than they were doing pre-pandemic. But many of them have not received the appropriate compensation for that increase in workload. What are the pay differentials for remote, hybrid, or in-person work that we have to put into place? What about merit increases? And that's where I think CCBHC is helping, because it does allow us to do those market adjustments. I was working with a team this morning and around a CCBHC staffing plan. And one of the things that became very clear is that the tradition, because they said, we just got our allocation from the state of what our contract's going to look like. And we got an increase here, but a decrease here. So it's basically a net of zero. See, the old way was that we got our allocation and we fit people into the budget, right? Based on how much resources we were allocated, or what we think the contract amount is going to look like. CCBHC allows us to reverse that, because everything starts with the golden thread. It starts with the needs assessment in the community. The needs assessment in the community drives the goals and objectives of the CCBHC. The goals and objectives of the CCBHC drive the interventions. What will we put into place to meet the unmet need, the healthcare disparities in our community? That drives the staffing pattern. The staffing pattern drives the competencies needed, the evidence-based practices, the resources, the infrastructure needed to deliver those services, which drives the budget. Then I can have an anticipated cost with an anticipated number of encounters or hours of service based on the needs of my community. See, that optimal workforce brings into play the right skills of the individuals, the dependability and availability of staff, the motivation, where are we going, what's their level of motivation and excitement, and the willingness of them to meet our expectations, that attitude, aptitude, performance, and behavior we've been talking about to help shape and create that workforce. So think about those retention strategies that we want to put into place. Sign-on bonuses, retention bonuses, length of service bonuses that we want to have in place for many team members. That sign-on bonus is offered at the beginning, and we're seeing that in more and more allied healthcare fields. Retention bonuses, what are you paying me to stay through a period of time during maybe an implementation or completion of tasks? Length of service bonuses, really rewarding teams for being with us for a period of time. And this is just a sample of those. If I'm here 1 to 5 years, $500, 10 years, $1,000, plus some time off. So really thinking about what that might look like for you as an organization. It's not so much the dollar amount, it's the recognition. Look at your compensation, your market analysis. Create a compensation philosophy. Many of the organizations that I've had the pleasure of leading, working with the board of directors to create that compensation philosophy, that we're going to be 5 to 7% annual performance increases. We're going to be 7% above market. Nowadays, we're looking at least 10 to 20% above the regional market. See, if I've got a good manager, Gallup and Sherm agree that if I've got a good manager, I'm going to stay. And I think Sherm has even identified that it could take over a 20% pay increase for me to leave a good manager. So it's not just throwing cash at our staff. It's aligning compensation with performance, an environment of coaching and well-being. Looking at those recruitment bonuses. I always offered our staff recruitment bonuses. If I had great team members, they're the best spokesperson for the organization. So do they have anybody they know that's just like them, that could meet the goals and objectives of the organization? And if you brought a good team member in, regardless of the type of role within the organization, because you are aligned with the mission and vision and values of the organization, you like it here, I'm going to give you an incentive. So the first day that new employee shows up, you get a check in your mailbox. When that new employee completes their probationary or orientation period, you get a check in your mailbox. When that team member finishes their first year of service, you get a check in your mailbox. No limit of how many people you can bring in. So think about those staff recruitment strategies. You want to be able to lead with your organizational mission, vision, and guiding principles. What opportunities are out there for advancement and education? How flexible are you? What sets you apart from the competition? Use your team members as your spokespersons to help recruit and market. Ask your great team members why they like to stay, what makes it valuable for them, and lead with that with your teams. And then developing sort of our 90-day organizational climate kind of response, thinking about our staffing and our coworkers, recognition and growth, leadership, compensation and benefits, physical environments, quality, satisfaction. This is part of the work that we do as part of our organizational analysis, as well as our workforce development consultation work with teams all across the country. So developing kind of those 90-day plans, those successful plans in what we do. Are there any questions that anybody has? I know we've got quite a few folks on the line. We will be sending out the slides for both today and tomorrow, as well as the link to the recording that you'll be able to access this after today's meeting. Anybody have any key takeaways from today? Perhaps of what they have found helpful in the work today? So Madeline says the tips for measuring performance expectations. Jennifer says coach up or coach out was a great learn. Anitra says communication was part of that and those values. Andrea, you have your hand raised. I'm going to unmute your phone. Did you have a specific question?
Yes, I do. Thank you. You had mentioned earlier about fully remote positions or hybrid positions. At our clinic, we do allow for our APs to have a hybrid schedule, but we're finding it difficult to allow hybrid schedules for like our crisis workers or our care coordinators. So I'm just wondering if you have any suggestions on how we could offer that for those roles, or how we could, maybe manage or explain why it's difficult to implement that to our team.
Well, I think you break down the role. So think about what part of crisis, what part of care coordination could be done remote or hybrid. I see both those could be hybrid. I'm reminded of one of the teams that we worked with quite a while ago, Lifeway CMH in Michigan. We developed, this is long before any of this, they developed the ability to remote in for their crisis team to do crisis screenings in the hospital. We're seeing that with mobile crisis, with teams that are doing CCBHC, giving iPads to the sheriff's deputies so they can connect with their mobile crisis 24/7 staff. So I think there's an opportunity to be very successful around that.
Thank you.
Marie Wacker, I see your hand is raised. I'm going to call on you if you would, please. Marie, let me unmute your phone. I lost you, Marie. Let me see if I can find you again. I think you might have dropped off, Marie. You want to raise your hand again? I'm happy to call on you. Any others who have questions, please feel free to raise your hand. Heidi, quickly, I manage a clerical staff with an agency. What are some things a manager can do to encourage productivity when staff can be at different life stages and incentives? I think find out what motivates them. What motivates them? What incentives? Do I have an opportunity for incentives to pick from? Would I prefer more time off? Is it financial incentive? Are there other benefits? Well, I can see that we're a little bit out of time. We got a lot of questions. We'll allow for more time for questions tomorrow. If you haven't registered for tomorrow's part 2, please do so. And I look forward to talking with everyone soon. Thank you, everybody. Have a great day.